One of the common questions asked is, are yeast infections common after hysterectomy? In general, this is not a question that is to be asked. Because hysterectomy is considered to be a very serious surgery, the risks and the problems it could cause are too great. If a woman has a hysterectomy, she is just one operation away from even more risks and complications. When the physician performs the hysterectomy, the surgeon usually removes the uterus and part of the vagina to treat the cause of the infection. There is no guarantee that the infection will not return. Another risk is that the infection can become resistant to the medication used to fight it. Hysterectomy has many complications. These are far more serious than a simple yeast infection. The surgeon or the doctor that performed the surgery should keep all of the information about any complications to inform the patient and the medical team. A small percent of patients who have had a hysterectomy develop blood clots that require hospitalization and special treatment. These blood clots can be dangerous if they do not get treated right away. They can cause strokes, blood loss, internal bleeding and even death. Yeast infections can also be very dangerous. When a woman experiences a major infection, she is likely to experience excruciating pain. This pain may be severe enough to cause post-operative bleeding. Many times, women who experience a lot of pain cause their surgeons to miss other complications.
In fact, women may have an infection that has gone undetected due to the pain associated with it.
Many times, patients tend to panic about their pain, and this in turn causes them to forget to tell their doctors of any other problems they may have. Many doctors report that approximately 80% of all patients who come in with infections are yeast infections. In most cases, this infection is not linked to the surgery itself. In many cases, it is connected to previous infections that occurred before the surgery. Studies have shown that in some cases, chronic vaginal infections are a symptom of a pelvic inflammatory disease called treatable ovarian hyperstimulation syndrome. It is believed that the infection develops as a result of the inflammation that is brought on by the disease. Some doctors do not think that yeast infections are caused by this disorder. Infections after a hysterectomy are common for women to experience. Candida infections are common among women. These infections can cause symptoms such as burning, itching, vaginal discharge, pain during intercourse and infertility. Other symptoms include unexplained weight gain, fatigue, depression, bloating, headache, migraine, muscle aches, discomfort and other infections can be present. Most of these infections will clear up without any special treatment. However, there are some cases where symptoms will remain for months or even years. Women may experience recurring infections after a hysterectomy. In some cases, women may suffer repeated infections after the surgery. Unfortunately, most women are not made aware of these possibilities. Because it is considered to be a complication, these women are never told to look for a reason for these complications to occur. This is a serious problem. Although most infections are not serious condition, they can still cause complications. This is why it is recommended that women receive a health checkup after having a hysterectomy. A thorough evaluation of the infections in the area and a consultation with a specialist will help women identify if they have a condition that can be treated effectively. For more and in-department knowledge on this topic, like what to do, what to take, and preventive tips including treatment and cure, please check and go to our website on the link in the video description below. And don't forget to subscribe to this channel and also hit the bell icon for instant update on our latest videos and trainings. And please don't forget to share this video as well for others to benefit from.